can see a lot of them. So we'll start with the editorials, and meantime everybody can join in.
Of breathtaking beauty and absolute tranquility, Madhuban Resort and Spa exemplifies luxury that is soaked in tradition.
Madhuban is a home away from home. With his vast, enchanting gardens, Team Madhuban always awaits to give you service with a smile. Adding to that, the aromas of cuisines from around the world makes Madhuban a perfect wedding destination.
At Madhuban, an experienced team of wedding concierge and event planners are committed to weaving together moments that are certain to stay with you for a lifetime. Because moments as special as your wedding need a destination as special as Madhuban. Madhuban Resort and Spa, luxury soaked in tradition.
Thank you, Chitra. I think Sajni, you may begin, and Dr. Vijay is here. Hi, and I see a lot of the doctors. So Sajni, you may begin. Rupa is there. Hi, Rupa.
Thank you so much, Taruna. Thank you so much, Taruna, for giving me this opportunity to introduce a friend. Welcome, Dr. Vijay, and welcome to all the past chairs, and to Taruna and to the team of FLO Ahmedabad chapter. It's a fabulous team and a fabulous year. We've had a lot of programs, but it's great to see so many attendees. As I move over to introduce Vijay, I would like to also welcome the 10 panelists, the esteemed panelists who are here through his team. Thank you so much for being a part of this. So Dr. Vijay, Dr. DG Vijay, and we fondly call him DG. He is the first exclusive breast cancer specialist in Gujarat, trained at the best centers in the world. He is also the director of the largest surgical oncology group in India, which has been in existence since 26 years. He's the founder and director of Gujarat's first and largest private comprehensive cancer institute, which is the SCG Cancer Institute. But this is his professional introduction, which you've already read on the invite, and which you can Google so easily, like I always told him. I wanted to know more about him personally. So actually, he's a Xavierite, and so we are friends from very, very long ago. But after school, as all of us go our separate ways, we rekindled our friendship with the various fashionable reunions that are happening these days, and we met again. Also, a few of my friends are cancer survivors, and he has been their doctor. So today, as a brief introduction of him, I would like to tell everybody what they feel about him. And also, for me, he's an extremely jovial, affable, and positive personality. And I have heard that you can fight cancer the best if you are positive, jovial, and affable. And I saw that when I visited my friend through her entire course of chemotherapy, etc. So one of my friends says, when I was first diagnosed with breast cancer, I checked with a few doctor friends as well as cancer patients about the best doctor to go to. The one name that practically everyone recommended was Dr. D.G. Vijay. In all the nervousness of being diagnosed, I was so pleasantly surprised to meet this great doctor who was so friendly and humble. Meeting him gave me confidence, and all my apprehension about the surgery and cancer itself eased out. Ahmedabad is privileged to have such a world-class doctor with such a fine hospital amongst us. Warm, affable, compassionate, and a genius is how I would like to describe him. That is Shaili Mehta for you. I have another friend who says, getting my treatment done by Dr. D.G. Vijay always made me feel that I was safe and in the best of hands. He was always available for any problem throughout the treatment. His guidance was so helpful. He is a wonderful person too. And that's my close friend Nishu.
We can't hear you. Sajni, you've gone mute.
Okay.
Yes.
So, I hope you have heard the recent the introduction I've given about him. Over to you so that we can proceed with the program. Thank you so much, Taruna, for this opportunity again. Welcome, DG.
Thank you, Sajni, and very good afternoon to everyone. It feels good to see you all again after a long break, and definitely look forward to another great webinar with our esteemed guest today, Dr. D.G. Vijay, and all the esteemed panelists who have joined him today. I would definitely like to mention everyone's name because they are special for us today. Dr. Sonal Desai, Dr. Archana Shah, Dr. Mansi Shah, Dr. Mansi Vishal, Dr. Diva Shah, Dr. Aneri Shah, Dr. Sejal Dave, Dr. Pahili Bhatt, Dr. Kinjal Jani, and Dr. Tanay Shah. Thank you all for participating in this program today, and it's my pleasure to welcome you all on the platform of Ahmedabad chapter. FLO Ahmedabad chapter. FLO is, I'm sure you all know, but I would like to say, as per the protocol, is the women's wing of FICCI. We have 17 chapters pan-India, covering different geographical locations all over India, headed by our national president, Ms. Janvi Fukan. FLO also represents 8,000 women entrepreneurs and professionals, and we work towards the empowerment of women by the women at all levels. Now, breast cancer is a public health concern. That's a year-round issue. And it's good to draw more attention to this issue from time to time. And that's why we have the Breast Awareness Week in October. We have been delayed due to some reason or the other, but Dr. Vijay has been really helpful in accommodating us late, but not that late. So I'm glad to have him and his team here today to get more in-depth insights in this topic, as I believe that the awareness of the causes and symptoms of breast cancer can help save many lives with knowledge and timely actions. So thank you again, Dr. Vijay, and the whole team for taking out your valuable time for us. And I invite you and the team panelists to enlighten us on this killer disease and help us to be always alert in case, God forbid it ever strikes any one of us. And I'm sure after today we'll be more knowledgeable to make sure we avoid it. Thank you, and I leave the desk to you, Dr. Vijay. Welcome. I think you're on mute, Dr. Vijay, so just unmute yourself, please. Yes. Now you may begin. I think you're unmuted. Still not able to hear you. Is it me or everybody else can hear him?
No, we cannot hear him.
Okay. Just be patient, everyone. Trying to reconnect with Dr. Vijay. He's having a problem with his audio, I think. Sajni, maybe if he comes off sharing the screen and come back on again. I don't know if he can hear us. Can you say something, Dr. Vijay, because we can't hear you? No, not audible.
We can't hear you, Vijay. We have a wonderful crowd today. We are 93 now. Congratulations, Taruna.
Thank you. Oh, thank you. I'm so absorbed.
94 now, 94 and counting.
Thank you. It's a very, it's a subject which...
which is close to all of us.
Yes. And another thing is, when you know somebody who has already been through it, you are more anxious to know what is in store for us that we can do to save ourselves from such a killer disease, I can say. Because I say a killer disease because I have lost a couple of family members in this. And I've also got a lot of friends and family who have survived. And most of them from the US. That's another thing I wanted to know from Dr. Vijay later on, of any of the panelist doctors, whether this applies, not applies, the Indian women less, I mean, the percentage, is it lesser than the one abroad in the US for the cancer stricken women? Are there, what is the percentage like? If somebody can answer, I can see Dr. Sejal the way. While we are waiting for Dr. Vijay, maybe we can have a conversation. If anyone can answer, what is the percentage rate of women in India being struck with this?
No, Vijay, we can't hear you.
You can't hear me?
Yeah, no, I'm telling Vijay, he's trying to still check.
Okay. Maybe he can start another instrument.
Yeah, and just call him.
But anybody has an answer for my question, I'm willing to listen, and I think everybody else, we just keep them busy.
Taruna ji, can I answer?
Yes, please. I can.
I am Dr. Archana Shah, gynecologist.
Thank you. Yes, please answer, Dr. Archana.
I am till sir connects with us.
Yes.
Yes, in US breast cancer the rate very high, but now in India too we are seeing lot of patients with breast cancer, and it is increasing like anything. As you said, and friends also, there are many patients. So now India is also now, I don't know the exact percentages, maybe sir would give more light on that, but definitely now in India also breast cancer is increasing.
Is it because
And we are
people
seeing
are ignorant? Is it because people are ignorant, or they don't want, they are not with it for the yearly checkups and all that, or is it, why has it increased? Is it due to
in Western countries, actually, mammography is a must, and
Yes.
it is included in their insurance companies.
Yes.
In India, if like we have how many ladies with us? We have almost 98 participants. So
Yes.
let me ask, okay, how many out of maybe 90 women, how many of us go for our annual? So unless and until it is a compulsion, we don't go for our mammograms.
Yes, I am one of them. I'm sorry to say that.
Or if we have a family history, we would go. Otherwise, we don't go for our annual mammograms.
Yeah.
That is one of the main things, that we don't do the screening for breast cancer.
Yes.
And we are now seeing many young women having breast cancer. It's not that the disease of breast cancer is for 50s or 40s. Now we have also 30s and 25. Sir was telling me the other day that he had the youngest patient of 25-year-old.
So is it only the married women who get it, or it could be unmarried girls also, if it is passed on?
In also breast cancer is seen.
Can I add something?
Yes, sure.
Taruna ji, you can hear me?
Yeah, I can. We can all hear you.
Yeah.
And as soon as Dr. Vijay is on, please let us know once you're on, so we stop our conversation. But you go ahead for now, Dr. Archana.
Yeah. Sonal. I'm Dr. Sonal. So,
hello.
Yeah.
Can you hear me now?
Yes.
Yes, we can. We've been waiting to hear your voice. And so I think you were just waiting for it to become 100 people, because now we are 100.
Yes. So sir has now made a century.
Can the host allow me to screen share?
Yes, just hold on. Chitra, can you please allow screen share? Chitra?
Yeah, I did.
Okay. And Chitra, please stay on. Okay.
Can you see the slides now?
Yes, we can see.
Yes.
We can
All right,
hear
so
you also.
let's get started. I think we are running about 5 to 10 minutes late.
Doesn't matter.
And I'm very thankful to FLO and all the office bearers, especially Taruna and Sajni and many others who are very instrumental in getting this event. Ideally, we would have wanted to do it in October. I think we were in conversation since then,
Yes.
but the COVID and many other logistic problems came up. So this is the panel of doctors, except Dr. Sonal and Archana, who are gynecologists. The rest are the team members who work with me in treating breast cancer patients at the HCG Cancer Center in Ahmedabad. And it's a very informal, at the same time informed, and hopefully a very interesting discussion on breast cancer. As Taruna was saying, the number of cases, and we keep hearing of breast cancer in our own friend circle. And therefore, it's very important that we be aware of what are the causes, what are the risk factors, and try to mitigate them as far as possible.
Yes.
Maya Angelou, a very famous American poet, said that my mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style. And that is how we want women to live. Sajni, I'm sure you will agree with this statement: passion, compassion, a lot of humor, and a lot of style. And that is how women should be living their life till the age of maybe 80, maybe beyond. My first question to Dr. Tanay Shah, uh, what has been the trends in breast cancer that you see in your own practice? Dr. Tanay Shah.
Yes, sir. Very good afternoon to all of you. So this is a very important question. So previously, just 5
And what
years
are the number
ago,
of cases that we see in India every year?
so now Dr. Archana is, she also was discussing that number of cases of breast cancer in India is on the rise, and now we are paralleling the world data. So previously in India, the carcinoma of the cervix, that was the a type of uterine cancer, which was the most common female cancer in India, but now breast cancer has overtaken it. And if we see the latest data, the most common cancer in females in India also is breast cancer, like the overall world data. And 27% of the females female cancers in India are breast cancer cases. So it is gradually increasing. The age also is coming down. Previously, we
I
used
will come
to
to that in a minute. So what we also need to be hopeful. So what Dr. Tanay was saying, that a large number of breast cancers and the cancers are increasing, but at the same rate, survival rates are improving because of greater awareness, early detection, and advances in treatment. Yeah, continue, Dr. Tanay.
Now we are seeing that the age is also decreasing. Previously, we used to see cases in 50s and 60s. Most of the
Correct.
females were found in 50s and 60s. Now we are seeing many cases in their late 30s as well as in 40s, which are more aggressive cases.
Correct. So, as you rightly pointed out, over 150,000 new cases of breast cancer in every year. 1 in 24 women is likely to be diagnosed with breast cancer, one new case every 5 minutes, and nearly 300 new cases every day.
This one new case every 5 minutes, this is in India or is it world over?
In India. In India.
Thank you.
So, what Tanay was saying, that 60% of cases, unfortunately, in India are diagnosed in stages 3 and 4. The mortality is very high because we often see patients coming late, and if 50% of the cases diagnosed of breast cancer in India are likely to die of the disease, whereas only 20% of the women diagnosed with breast cancer in the United States are likely to succumb to their disease. So this is a very alarming statistic, and therefore we need to diagnose cancer early. Probably I will discuss with some of the panelists, there may be no absolute way in which we can prevent breast cancer, but early detection is the main key in treating breast cancer. And the incidence is further likely to double. As Tanay pointed out, again, we see women in very early ages of 30 and 40 years of age, 45, when they are at the prime of their life. Their children are very young. Some of them are likely to get married or in college. And the lady has a lot of responsibilities on her. And that is the time when cancer strikes. And it's really a big burden onto the family. Again, my question to Dr. Tanay, it is, are all breast lumps cancerous or some of them non-cancerous?
No, actually, it's a myth. For a woman, it is very important to understand that all the breast lumps are not cancerous. Many of them are attributable to various hormonal changes going on throughout the reproductive age group of the female. So many of them are benign lumps. Only few of them are cancerous. But the most important thing is, whenever she notices a lump, it is always better to get it checked
Correct.
by a particular person.
I think that is a very important message. 9 out of 10 lumps occurring in the breast are likely to be benign, and therefore it is imperative for the doctor to pick up the malignant lump at an early stage and treat it accordingly. But whenever she notices a lump, she should seek medical attention and appropriate investigation, is what he's trying to say. My next question to Dr. Mansi Shah, who is Dr. Tanay incidentally is a breast cancer surgeon specialist. Dr. Mansi Shah is a medical oncologist trained in some of the best centers in USA. And I would like to ask her that what are some of the risk factors associated with breast cancer? Dr. Mansi Shah. Mute.
I'm not okay. Hello, good afternoon, everyone. Thank you for having me on this platform, and it is my privilege to be here. In terms of the question that Dr. Vijay just asked, in terms of risk factors, so I think there are two main things to consider. Some of them are modifiable risk factors, meaning risk factors that we can actually act upon, and some are non-modifiable risk factors. Risk factors that are associated with increased chances of a woman to have breast cancer are weight. So we know that obesity increases the risk for breast cancer. Lack of physical activity and a high fat diet again goes with weight. Excessive alcohol, smoking. If you have had prior therapy for any previous cancers, like sometimes you can, as a kid, you might have lymphoma or some kind of cancer, increase the risk. Post hormone replacement therapy means prolonged use of progesterones, and then there is a hereditary risk factor. So if there are a lot of family members, sure.
Yeah. So essentially, I asked you this question because a lot of women feel that they have no risk factor, and many of them believe that family history is a very important factor. And they don't, even when they notice a lump, they seem to disregard the fact. And it should be noted that more than 70 to 80% may have no risk factors at all.
True. So only 5 to 10% of breast cancers are actually hereditary, where the family history is known. So most of the times we end up giving the answer that in one particular patient, we don't know exactly why the cancer has been caused.
That is probably the most common cancer. Dr. Aneri, as a psycho-oncologist, how do you deal with this issue that why me? You know, many women may ask the question that even when I have no family history, why have I developed this question? Dr. Aneri?
Yeah. So why me definitely is the first question that pops up after they have come to that acceptance of, why that I have got cancer, but why is it that me? Why at this age? These are the most common things that they get. And the way to deal with this is that you channelize that thought in a meaningful way in whatever their existing beliefs are. It could be that scientifically, medically, we have a limited answer to this. That why some things they get despite of any past history and or may or may not having. So basically, once you have channelized it into a meaningful way, it's very important that the patient this answer is taken care of, because only then will they start thinking about what next, what further. Only then will they channelize their energy into doing their next subsequent steps more smoothly. So the ones who have spiritual beliefs, it should be handled spiritually. The ones who understand it medically, it has to be handled medically.
Okay. My question to Sejal, because Dr. Mansi pointed out that leading a sedentary lifestyle could increase your chances of breast cancer. So how does exercise basically help in reducing the chances of breast cancer? How does exercise help?
Okay. Good afternoon, all of you. Yeah. Good afternoon to all of you. Actually, we have regular exercise can help us to reduce our body fat percentages and helps to maintain the healthy weight. And it is very important to do the exercise regularly. So estrogen level in our body cells will help to reduce with the exercise. And exercise strengthen our immune system. And estrogen is a main factors which lead to the breast cancer. So exercise provides you to help you increase your immune system, even your mental health and your stress relief also. So we have to regular do 150 minutes a week.
Yeah, I was
regular
coming to
exercise.
that. What is the minimum amount of exercise that is recommended by the American Cancer Society?
Okay, that is 150 minutes of a physical activity per week. That is the minimum requirement to do by regular lady nowadays.
Okay, so you would recommend things like using the staircase instead of the elevator, going for a walk, wearing a device, active. So all the slides have been prepared by the experts themselves, and I am just the moderator who has compiled all these slides together. So these are various things that we should do to lead a healthy lifestyle. Doing household work does not qualify as exercise. Please note, you have to do exercise in the form of walking, jogging, swimming, going to the gym, yoga counts. So it's a very active, healthy lifestyle. So this is a slide that I put up that if it doesn't challenge you, it doesn't change you. So you need real good exercise, especially around the time when you are perimenopausal. So if you are young and a little overweight, maybe that is okay. But once you approach menopausal age, all the estrogen is stored within the fat, and therefore it becomes very important that you attain ideal body weight as per the Indian charts. I'll go back to Mansi. Women believe, does breast cancer occur only in women, or do you see occasionally men with breast cancer? What's your take on that, Dr. Mansi?
Yeah, sorry. So I think male breast cancer is something that we need to definitely raise awareness about. Male breast cancer can happen, although it is not very common occurrence. The occurrence is maybe 1 to 2% of all male cancers might be breast cancer. The hereditary factors that we talked about may increase your risk of having a male breast cancer.
So at this point, I would like to point out that male breast cancer is also a reality, especially if you have certain risk factors, your family history is very strong, then even men can develop breast cancer, and it needs to be treated as per the same protocols that are followed for female breast cancer. I would now like to talk to my dietetics and nutrition expert, Dr. Paheli Bhatt, that what role does diet play in the in breast cancer occurrence, the causation of breast cancer? Can I also request all the participants to keep their phones and devices on mute and let Dr. Paheli Bhatt answer the question. Paheli.
Yes, sir. So I request you to repeat the question, please.
What is the role of diet in breast cancer?
The diet plays a very important role in breast cancer. Once you are detected, and even if you're not detected, it is very important to have a healthy, nutritious diet. Once a patient is diagnosed, if he or she has a proper nutritious meal.
Not diet in breast cancer patients, but before breast cancer, anything that, these are the women we are talking to today are not breast cancer patients. They are healthy women. And what change can they bring in their diet so that their chances of breast cancer are reduced?
Yeah, so in a day-to-day life, if we see, according to recommended dietary allowances, if a patient, if a normal individual has a proper intake of all the 5 food groups, say cereals, pulses, nuts and oilseeds, dairy, fruits and vegetables, etc. So all these food groups help a person to maintain a healthy lifestyle. Apart from that, we are seeing a lot of people are obese these days. So, maintaining a proper lifestyle along with proper weight, proper BMI, and overall maintenance of life adds in to giving a healthy lifestyle to the individual and not
So what
inviting
happens
diseases.
is women who
Apart from
have
that, a
excessive
proper
body
intake of
fat,
proteins and antioxidants has always proved to be beneficial for every
correct.
individual.
Excess body fat leads to increased estrogen activity, as this slide shows, and leads to cancer promotion. High fat, high sugar, low fiber diet are responsible for increased estrogen activity. Paheli, can you just shortly enumerate all the metabolic tumor promoters listed here, please?
It's interleukins. These are the tumor promoters which I have noted. The interleukins are the main factors which influence the tumor. The insulin, the oxidative stress which leads, uh, like, which occurs as soon as the cancer is. I'm sure. I'm sorry. There's some problem in my network, so I hope everything is clear. So the insulin, estrogens, oxidative stress, inflammation in the body. It has also been proven that more sugars leads to more inflammation. So usually we ask the patients to cut down on these sugars. So
Okay.
whenever there is more inflammation, the chances of cancer are increased.
So this is what our dietetics and nutrition expert is recommending: the right proportion of protein, cereals, grains, water, fruits, vegetables. They'll give you the right mix of minerals and vitamins and reduce your chances. However, saying that even if you are eating a healthy diet, you could still develop breast cancer and need to be cautious about that. This is taken from my favorite Indian dietitian Rujuta Divakar, who said, eat in moderation. Women often come to us and say that I'm eating in moderation. You really need to count your calories, avoid junk food, don't avoid sugar, ghee, rice. So in moderation, anything is good. Eat according to the season. And I also have a faith on the wisdom of Indian food. So this is the right time to probably eat adadiyas and mundias and all that. And so in winter, whatever is available in winter, go ahead, eat in Indian food, and that your chances of cancer are going to be reduced. I'll come back to Dr. Aneri Shah, who is a psycho-oncologist. She counsels all our patients prior to or post therapy. And Aneri, you know, the woman has multiple roles to play, of the mother, the daughter-in-law, the wife, and so many things. And many women are actually working. We have so many doctors and two gynecologists, Dr. Sonal Desai and Dr. Archana, who have very busy practice. So maintaining a balance between playing so many roles is a very challenging issue. And that leads, and then you are diagnosed with breast cancer. So the amount of stress is huge. This is what Maya said to women, that if you don't like something, change it. But unfortunately, you can't change breast cancer. If you can't change it, change your attitude. So how to change your attitude once you are diagnosed with breast cancer, or even before that, a general, how do you change your state of mind?
Okay.
Dr. Aneri.
Yes. So the first thing is that women, as a woman, there are multiple roles that you play. A lot of females, once they are diagnosed with breast cancer, when asked, they do tend to report that they regret having ignored the lump before a few weeks or months that they were, because they were so occupied in the roles that they were in. So first thing is that should definitely not be the case. In low socioeconomic strata, or I don't know, basically there is a lot of stigma around talking about breast cancer also. So that also should be, actually it would be great if in families also this can be discussed freely. If other members of the family also become aware of for the health of women, it's very, very important. Only then can they support and motivate her to talk about problems that she is going through. And third thing, that the belief that cancer has no cure is still prevalent in whether it be a low socioeconomic strata or whatever economic strata we are talking about. It is still prevalent, and it has to be like I think breast cancer awareness month is a one very beautiful way to create this awareness. What we are doing is really amazing then. Changing the attitude it will only come with the acceptance that yes, this has happened, and now what next further. This is the key, that unless and until the acceptance doesn't come in, there's no way you're going to go ahead and do anything further, channelize your energy into. You're already going to stress your body with all the treatment, surgery, chemotherapy. Now on top of that, you're creating that psychological stress as well. Is not going to be helpful. It's only going to worsen your quality of life. So acceptance is the key to this whole thing, to change that.
This was a slide sent to me by Aneri, and I think it's a very beautiful slide which talks about quality of life. What do we mean by quality of life? In the sense that whether it is financial, occupational, psychological, physical, social, spiritual balance. So it is not being absence of disease. Aparne koi rog nathi, that is not a quality of life. I must also be healthy. So for those who understand Gujarati, let me tell you, whether it is arthik, સામાજિક, શારીરિક, માનસિક અને આધ્યાત્મિક, આ બધા જ આપણા જે factors છે, એ બધામાં we do well on all these parameters, then we have a very good quality of life. So it's very important. I think quality of life is a very important indicator of the health of women. And once they fulfill all these 5 parameters, whether it is, as I told you, arthik, samajik, sharirik, mansik, and adhyatmik, then any challenge that we meet, we are going to meet head on. My last question to Aneri is, what advice do you give to women before and after when they are diagnosed with breast cancer?
Okay. First and most
How to deal with stress in real life?
What, sir?
How do you deal with stress? How to deal with stress?
Yes, absolutely. So the first and foremost thing I want to point out is that we do, all of us, in forms of our thoughts, we do self-talk. There are things which we tell ourselves that, oh, I look good, I look bad, I performed well, I did not perform well, I curse myself for certain things, I might praise myself. So it's very important to identify this, the self-dialogue that we have. These are the thoughts, and thoughts ultimately will impact what you feel. And that will ultimately lead you to your actions. If I feel good about doing something, I will do it. If I don't feel good, I will not. And that feeling is determined by the thought that I've had about that particular event. So becoming aware about what you are thinking, you don't give bad food to your stomach. You know, you'll end up vomiting, you'll end up constipating, you'll end up into loosies. So in the same way, you don't give yourself, your mental self, that bad food in form of those thoughts. So if there is a problem, seek help. Exercising helps definitely, because the way body has an impact on mind has an impact on your body. It helps you regulate a lot of other systems, and every emotion that you experience has scientifically, it is proven now that it does have an impact on each and every cell of your body. So you know how important it is. Let's not ignore that part as well.
Okay. Dr. Mansi, I think you were talking about some modifiable and some non-modifiable risk factors. So which of these are modifiable that can be controlled? Dr. Mansi Shah?
Yes, sir. So I think exercise, like Dr. Aneri just said, is something that you can control. Take out maybe just 45 minutes from our daily routine for ourselves and perform exercise that increases our heart rate. That would help reduce your body weight. Some of the other modifiable risk factors are, and I didn't mention on this before, is that if you have an early menarche, meaning you start having your period early, or if you have menopause late, or if you have children at a later age, if you don't breastfeed, these are all increases, these are all risk factors that increase the exposure to estrogen hormone during your lifetime. And so if you have children, say at an early age, make sure you breastfeed for a minimum of 6 to 12 months. These are hormonal changes that you can do. The other thing is you have avoid smoking, alcohol, and hormone replacement therapy is usually not very routinely recommended now for postmenopausal females who have menopausal symptoms. We try and do other things, but try and avoid hormones from outside in whatever way that is. So I think these are some of the modifiable risk factors.
Thank you. Thank you so much. At this point of time, I would like to point out that a lot of women nowadays are undergoing treatment for infertility, and that has been the major issue. So some of the treatments, Dr. Mansi, do you believe that infertility treatment leads to increase in the chances of breast cancer?
So I think we don't know for sure. Infertility treatments, they do cause stimulation of your ovaries and do include a lot of hormonal manipulation. So, it might increase, but I don't think we have enough scientific evidence so far. Maybe in the long term, we will.
So there is no evidence today for us to say that the infertility treatment that our experts are doing, or even the oral contraceptive pills that are available in today, are responsible or can be considered as risk factors for the causation of breast cancer. Thank you, Mansi. My next question is to Dr. Mansi Vishal, who is a genetic expert in our team. And for women who have genetic related cancers, they need a lot of complex counseling. All of you will remember the incidents of Angelina Jolie, who had multiple family members with breast cancer, who eventually underwent genetic counseling and a lot of treatment after that. So my question to Mansi Vishal, how do genes cause breast cancer?
Hello, everyone. Thank you, sir. So it's a very basic question, but a very important question. So the thing is, all of us, we all need to know this, that all of us inherit DNA from our parents that we know. So all of us have 2 copies of each gene, and 1 copy we inherit from our father, 1 copy we inherit from our mothers. Okay, so in total, we have 20 to 25,000 genes, we humans. And out of those 20 to 25,000 genes, actually most of the genes, we have 2 copies of it. When one of the copy has a genetic change, which has the potential to cause cancer, then that person is at risk for cancer in their lifetime. Because we are talking about breast cancer, suppose a woman inherits one genetic change from one of the parent, then since birth, actually, she is carrying that genetic change in her body, and she is at risk for breast cancer after 25 years of age, at least 20 years of age. It's an adult onset breast cancer when it is hereditary.
I think that was one of the most simple explanations of genetics that I've ever heard of. Go ahead.
Okay, so I just tried to make it simple so that we all are aware that like since birth we are carrying the risk. So many patients ask that, okay, if I'm carrying that genetic change, which means for sure I'm going to get cancer. It's 100%, but it's nothing like that. We always are at risk of cancer. It's not 100% sure that we will develop cancer. So like, sir, I think you are going to ask about BRCA. So I will explain the risk.
Let me come to that. So the point you are trying to make is that all of us have genes for everything, and those genes may undergo mutations, and those mutations cause cancer. But hardly 5 to 10% of all cancers are hereditary or familial. So other 85, 90, 95% of cases could be sporadic. So it is not necessary to have a family history of breast cancer. So all cancer patients may not have this genetic mutation. Most of them do not. And therefore, it is very important for every woman to be aware that she could still develop breast cancer even though she may not have a genetic mutation. Yeah, so which are the commonly implicated genes quickly, Mansi, in breast cancer?
Yeah, as you can see on the slide also, BRCA1, BRCA1 and BRCA2, these are the two most common genes which are responsible for hereditary breast cancer. So as sir said that 5 to 10% of all the breast cancers are hereditary. Out of those, so in those 5 to 10%, about 20 to 30% patients have genetic mutations, means genetic changes, which have mutation, which have potential to cause cancer. So these are the two common genes, and they, yeah, they. So I'll just tell the percentage, sir.
No, it's okay. Thank you. So some women in this crowd may have early cancer. How to detect it? So we will just talk a few slides about detection. My next question to Dr. Tanay Shah is: what are the common symptoms of breast cancer? We are running a little short of time, so can we have the symptoms of breast cancer, Dr. Tanay? Kindly enumerate them.
Yes. In brief, the symptoms of breast cancer mainly is feeling of any breast lumps. Another can be redness of the skin overlying the breast. There can be some lump in the axilla. In advanced cases, there can be symptoms like weight loss and anorexia, as well as lump in the neck or swelling in the neck. So these are briefly the symptoms, and nipple discharge is also another symptom. So these are the symptoms.
So breast lump, change in the size and shape, swelling in the armpits, nipple changes, breast pain can also be a symptom, but this is not very common. So this is how the various changes would look like: a hard lump, orange peel skin, discharge. There could be an ulcer on the skin. Sometimes the nipple may appear even to be shrunk. The whole breast may appear to be shrunk and very hard. So as far as screening of breast cancer is concerned, there is a good breast health plan which has a component called as breast self-awareness. The second component is clinical breast examination, which is usually done by a qualified nurse or a doctor. Dr. Kinjal, I think I have not been talking to you. So my question to you is, what is the drill for breast self-awareness? Dr. Kinjal Jani is the Director of Radiation Oncology at HCG Cancer Center, and he is one of the best in the field. So Kinjal, if you are online, please tell us the steps for breast self-awareness.
Okay, yeah. So now I'm unmuted. Yes, sir.
Okay, go ahead.
So can you repeat the question, sir? Because I was trying to.
What are the steps for breast self-awareness?
Yeah, so people should do a self-breast examination. That is one of the most important things. We usually rely on the surgeons to examine, but we should know how what breast feels like. So anybody they should know how to check their breast. So at least once a month, maybe first Sunday of the month, they can do the self-breast examination, which can be done in a standing position or a sitting position or a lying down position. So with the fingers of your arm, of your hand, you can palpate your different quadrants of the breast. You can press, you can feel, you can see in the mirror, you can see any changes you see in both the sides of breast. And any surgeon or any doctor can teach you how to do a breast self-examination. That plays a very important role as far as the screening is concerned.
That correct. So every woman needs to be aware of how her breasts look and should be conscious of any changes in. So for women who are menstruating, usually the breast examination is done 7 to 10 days after the periods are over. If your uterus has been removed or you are postmenopausal, then it can be done on any fixed date of the month. This was a beautiful ad brought out by Honda. As you can see, a couple of years ago, they wanted to create breast cancer awareness, and using their famous Honda logo, they also incorporated the breast self-examination into this, and it's considered to be one of the classics in advertising. As I told you, a clinical breast examination is usually done by a doctor or a nurse. Dr. Archana, I would like to ask you, you have a lot of gynec practice. So what are the things that you look for when a lady comes to you for maybe even a gynec problem? Would you examine her breasts, and what do you look for? Dr. Archana.
Yeah, so as gynecologist, women usually would come to us for any breast problems, and time when we can screen them is during pregnancy. During pregnancy, a breast examination is a must. That is one time when we see them. The other time is causal when they come for any bleeding problem or anything. At that time, we would like to see them and also give them information that they can do their own breast self-examination as told earlier. So we examine the patient in a sitting position and also lying down position.
Okay, okay. My next question is to Dr. Diva, who is our expert on mammography. Why are women reluctant to undergo mammogram, and how is it, at what age do you recommend mammography to be done? Dr. Diva.
Hello, everyone. It's my privilege to be part of this forum. So, as Sir said rightly, that self-examination is the best examination. And after self-examination, the clinical examination comes.
At what age do you recommend mammography?
So, mammography, there are specific guidelines which are for the low-risk woman and high-risk woman. There are the different recommendations. So, for low-risk woman, usually the guideline is the woman should undergo mammogram after 40 years annually. That is the guideline for the low risk woman. And for high risk woman, the woman should undergo the ultrasound examination at the age of 25 to 35 years. And after 35, annual mammogram or MRI as and when required. These are the guidelines for low risk and high risk woman. Still, we are seeing, sir has also asked me why the women are reluctant for doing mammograms. First of all, like they feel that they are painful procedures or there are hazardous of the radiations, but this all are myth because mammogram has a very soft radiation, and nowadays with the recent advances in the machines, they are almost painless procedure. So I recommend that every woman should undergo the screening program after the age of 40.
Thank you. Thank you. So the point I think we wanted to bring out is that exposure to radiation during mammograms is not causing breast cancer. So beyond the age of 40, it is mandatory that you get a mammogram done after the age of 40 annually every year. And that is how you can detect breast cancer early. And there are a couple of benefits of detecting breast cancer early, which we will discuss shortly. Dr. Tanay, my question to you as a surgeon is, do all women, what are the advantages of detecting breast cancer early?
Yes, sir. Am I audible, sir?
Yeah.
There are certain benefits. First of all, prognostically, it will be better if we diagnose early. Then, hello.
Yeah, they will live longer. That is what you want to say.
Yeah, they will live longer. Another is the type of surgery which we can offer to the patient. If the lump is too small, then we can probably offer the patient breast conservation surgery instead of complete mastectomy, that is the entire breast removal. So if the lump is too small and the breast size is adequate, so then we can very safely offer breast conservation surgery. So that is oncologically as well as cosmetically appealing to the patient. Another is in early stages, we need not to do complete axillary dissection. So patients, sometimes they come to our OPD saying that there is a lot of swelling in the ipsilateral upper limb. So problems of those kind can be avoided if we diagnose the case early.
So what Dr. Tanay is trying to say is that women who come in early, they are likely to live longer, they are likely to be cured, their chances of cure are higher, and we can conserve the breast in about 60-70% of cases if the small tumor is small. Do you have, so some women require mastectomy, Dr. Tanay. What are the options for women who undergo reconstruction after mastectomy? What are your options?
After complete mastectomy, we have a couple of options. One is through the implant. So where we put in the implant underneath the muscle of the chest wall.
Yeah, not technical details. Please just give me the two options.
Yeah, the one is implant and another is autologous implant, where we can use our own body tissue. That is, we can take the fat overlying the abdomen and we can reconstruct the entire breast.
Yeah. So either we can use an implant for reconstructing the breast, or we can use the body fat and do the thing. My next question to Dr. Mansi: what are the common side effects of chemotherapy because of which patients are reluctant to take chemotherapy and do not complete their complete treatment? Side effects of chemo.
Yeah, so I think in the chat box, there was somebody who had just asked that why do women lose hair during cancer treatment? And I was just about to answer. So I think, one of the main reasons why people don't want to take chemotherapy is that because they lose their hair, and hair is something that is a very emotional thing. It also kind of tells everybody else around them that something is wrong with them. And so we try and not get chemotherapy. So hair loss is something, we do have a device called a scalp cooling device, which is a cooling cap, which can help us keep our hair during chemotherapy, certain chemotherapy agents, not all. So I think that is something that you should probably talk to your doctor about if you are undergoing chemotherapy and if that is something that might work for you or not. Some of the other common side effects, people think that they have to stop working, they will go into bed rest, and they won't be able to do anything. They'll be a burden to their family. So we do have newer supportive medications, and the chemotherapy treatments we try and keep your normal activity as much as possible. So bed rest is not something that happens routinely with breast cancer therapies. Lowering of immunity and a high risk of infection. This is something that we worry about, especially in a pandemic situation like COVID. So we do use all precautionary measures to make sure that you don't get infected. But I think these are some of the common...
Okay. So my last question, Dr. Kinjal Jani, is do all patients require radiation? Is it very painful? Do they experience a sort of a burning sensation? That is what patients often ask.
Yeah, so radiation therapy is treatment with X-rays. So people don't feel anything while they take the treatment. And whenever there is a breast conservative surgery, those patients need to go for radiotherapy, because the day we decided to do a breast conservative surgery, they are candidate for adjuvant radiotherapy for sure. And if the mastectomy is done, then we only give radiotherapy if there are axillary nodes positive or the tumor is more than 5 centimeters in size. Only in those two conditions, we give adjuvant radiotherapy. And it is quite safe. Giving radiotherapy doesn't lead to any major problems as far as breast cancer is concerned. But yeah, because of the pigmentation of the skin becomes a bit thinner, a bit darker, which may lead to some burning sensations. But we have some creams to give. So nothing much to worry as far as the radiotherapy for breast cancer is concerned.
Okay. So these are some of the common myths. Touching the breast too often does not cause breast cancer. Ayurvedic treatment does not help breast cancer. Radiation does not cause breast cancer. Breast biopsy does not spread breast cancer. It can affect young people also. 1 in 24 can be diagnosed with breast cancer. Healthy diet and exercise routine can reduce your chances by nearly 40%. When caught early, breast cancer has a 98% survival rate. This is a fact. Nearly 85% of women diagnosed with breast cancer do not have a family history, and breast cancer diagnosis is not an automatic death sentence. Some women I'm going to talk to now. So history, despite its wrenching pain, cannot be unlived. So if you have had breast cancer, you have to live with it for the rest of your life, but then you can face it with courage, and it need not be lived alone. So before I go on to a short presentation, I would want to talk to Dr. Sonal Desai. And here I would like to quote a short शायरी. Sonal, सितारों से आगे जहां और भी है, सितारों से आगे जहां और भी है, अभी इश्क के इम्तिहान और भी है. So I think you were living a life like a dream. Your life was like a dream. I mean, a very loving husband, very well settled in life, children doing very well. And suddenly you had this diagnosis of breast cancer. Right. So what were your emotions at that point of time? And what was your coping mechanism? Dr. Sonal Desai.
Yeah, thank you, Dr. Vijay ji, and very good afternoon to all of you. Yes, the life was like, absolutely great. And it was my, it happened in 2013. It was my birthday, 12th December. I was in London, came back on 14th, and on 15th, I felt something is there. So I thought that it is just a boil, but naturally, mammography has to be done. So I went through mammography, and it showed the positive result for cancer. So basically, for me, acceptance was immediate. Being a medical student, being a medical person, it was very natural for me that these are the cells which they multiply in an abnormal way, but they are cells. So their presence don't work in my body. So that has to be treated. It has to be treated. And the second thing which Paheli said, that there was never a question like, why me? This is it. So now what can be done? So in that, my husband, my family and friends supported a lot. And one major sentence that Dr. Vijay ji said and Dr. Shailesh Bhai Talati, oncologist, told me that during this therapy, you need to undergo surgery, chemotherapy and radiation therapy. But during this therapy, your lifestyle will not be changed. So that was the best sentence, because I didn't want my lifestyle to get changed. So during after surgery was very easy for me. I was in the safest hand. So that was really great. And after that, during chemotherapy, yeah, Dr. Vijay, you were saying something?
After how many days after completion of your treatment did you go off on a vacation is what I'm trying to remind you of.
Yes, actually during chemotherapy, I went to Abu, then I went to Udaipur, I went to Dungarpur and had party over there, basically. And my radiation therapy got over on 30th June, and on 19th June, we were started our journey to Austria and Switzerland. So I don't have any bad memory.
So that is what we are.
Yeah, I don't have any bad memory.
So that is a message, positive message. Yeah.
Yeah, please.
That is the positive message that Dr. Sonal is trying to give, that, you know, you can live a very meaningful life, a life full of fulfillment, enjoy. A couple of years ago, her son got married, and you can enjoy your life just the way you were doing it before.
Exactly.
Any last sentence? May I introduce Dr. Sonal Desai as the daughter of Shri Keshubai Patel, our former Chief Minister, Gujarat's most popular grassroots leader, and who unfortunately passed away a couple of days. So Sonal and I were in college together, and it was really a moment of great, stress, little bit.
Yeah.
When I have to operate someone I know very closely, she and her husband, Dr. Mayur. So, but one last sentence from you, Sonal.
Thank you.
What do you want to say to the audience?
So yeah, basically, the early diagnosis is very, very important. We can't prevent it, but early diagnosis is very important. So during my treatment also, when friends used to come and see me, I told them that you first go through mammogram, and when you come to see me, show me your mammogram, because I care for you. So that is very important. I care for you guys also. So just get the mammograph done after 40 years, every 2 yearly or yearly, as the doctor said, and that is very, very important. Yeah, thank you.
Dr. Archana, a short message from you. Dr. Archana is a practicing gynecologist, extremely busy gynecologist. She underwent treatment about a year ago. And can I have a short message from you, Archana, a message of positivity, so that people go ahead and get their mammograms done? How has cancer affected you, and what have you been doing after the diagnosis?
Yes, I just got my surgery around 6 months back. I finished my chemotherapy and I'm taking radiation from Dr. Kinjal at HCG right now. A word about mammography. As you said, why the ladies, they don't come for mammogram. Yearly mammogram is a must. What happens is all ladies very busy in their own life, and 40 to 50 is a peak of life. So they don't get time for themselves. Like agar if you are normal, nothing is going to happen with me, मैं mammogram नहीं कराऊंगी. So you keep on procrastinating it. You say कि नहीं ये साल नहीं अगले साल. So one message is there, please schedule your yearly mammogram. Western countries में वो compulsory है because of insurance companies. India में it is not compulsory. For this, I just remember an incident. We were in Shenzhen and we went to the Asia's largest spa. And over there, I saw a group of ladies from the same family, like grandmother and the daughter-in-law and everyone. So why can't we do that as a yearly mammogram? Like schedule an yearly mammogram for all the ladies in the house. This is my message. Please go for your yearly mammogram, schedule it. You can take your other family members along with you, your mother-in-law, daughter-in-law, sister-in-law who are more than 40, and go for your annual mammograms. This is the main important message, because early detection of breast cancer, as you said, the survival is good.
Thank you, Archana. So if we can find time to go on a holiday to Abu, Udaipur and Austria, we must find time to get our annual mammogram done. I must thank all the panelists for a wonderful participation at such short notice. Thank you everyone for sending me their slides.
I would like to say that Dr. Vijay, I am also a member of FLO FICCI actually.
Oh, I see.
Thank you. Yes, I recognize
so
your
for
name,
the next
Dr.
5 minutes.
I recognize your name, and I was wondering because the whole year has been on webinars, so I've not been able to meet all the members. I mean, it would be lovely if we have a live, webinar like in the next couple of months and meet. It would be really great. And Dr. Vijay, I don't know whether that was the last question answered, but you may continue after what I have to say. I'm telling you, every doctor that you had on the panelists has given us a takeaway. I can't remember them all right now, but I'll go back on it. The last two, I must say, the takeaway from you, Dr. Sonal, it is your life experience that will give courage for most of the viewers today and their relatives to fight it out if it strikes, the cancer strikes to them. If not, to take all the precautions all of you have, given us. And Dr. Archana's takeaway, I must say, I think is the best. A reason for you and your family members to take a vacation together, and before the vacation, all of you go for a mammogram. I think that is the best takeaway. And I must appreciate each and every panelist you've had, Dr. Vijay, and for setting up such a wonderful program that teaches us a lot of lessons. And if I may, whenever you tell me, I have a question also. So
I will have just 1 minute, 5 minutes presentation left.
Okay.
This is a slide presentation of the activities that we have been doing, and which rightfully shows how women are absolutely rehabilitated. So we did one of our earliest breast cancer survivors meeting way back in 2008, and many of the women you see in that are still alive today. We also brought out a book called Questions from Her to Her to, a slide show, and which frequently ask questions about breast cancer. We did an event called Forever Beautiful, which was like a talk show where women came on stage and talked about their experience the way they are talking today. We were privileged to have the DGP of Police and the Chief Justice of the Gujarat High Court with us on that particular occasion. And women like Vrindaben came on stage, and Dr. Miss Pragna Shah. And fortunately, we have been very lucky with the support of friends, the media, and the television were widely covered some of these various activities that we did. As you can see here, the next year, when the Ahmedabad, the riverfront, the Sabarmati riverfront was ready, before it got inaugurated by Mr. Bodhi and the others, we were there and we took our patients in the balloon ride that was there. You can see some of them. And in this photo, you can see a couple of our doctors, Dr. Ashish Kaushal and Dr. Dushyant. And many of our international patients also were there at that time and went up in the hot air balloon. This is the entire team at that point of time, including some of our nursing staff. We also did a tree plantation program at Kankaria with some elderly patients and the ride that was available. Again, we had excellent help from the media as far as the newspapers, Ahmedabad Mirror is concerned, and also the television coverage was excellent. And this is me leading the group of women at the Sabarmati riverfront. So we also translated that book, Questions from Her to Her to, into Gujarati. We had a cooking competition for the following year. We had as chief guest Mrs. Sonal Ambani. Here you can see her, and Mr. Kailash Nathan and his wife, and Preeti Adani were the chief guests for that particular function. And women sent in their recipes. They were selected by the chefs of TGB, and they prepared them on site, and prizes were given away to the winners. The next year, Forever Radiant, we had meetings with school children, school teachers. We also had a book. You can see the mayor at that time giving away awards to all the winners. We brought out a book called RIP Breast Cancer, Real Life Incidences of 11 Brave Women. We had a short film called Stories of Courage, based on the life of these women. School children from various schools performed their entertainment programs. And these are some of the winners of that particular year. We also did a fashion show in 2015, and this is a coverage of that particular, and me with some of the various participants in that particular function. And you can see Sonal in the lower photograph with the other participants. Again, the media gave us excellent coverage. We did a Garba program in the subsequent year, and our breast cancer winners, as we call them, often participate in other events as well. One of our very popular participants called Dr. Urvi Sabnis, Miss Urvi Sabnis, who is also interviewed for various newspapers. We did an art painting exhibition. The paintings were done by faculty and students of JJ School of Art. They brought out about 36 paintings which we exhibited, and the exhibition was inaugurated by my friend Mr. Anil Relia, and again we got very excellent coverage. This year we did in February, before the pandemic, we did an event called Fabulous Forever, which was a fashion show. These are the photographs from that particular event, and me at the center of the whole fashion show, so to say. You will see some lovely ladies who have been operated for breast cancer, but you cannot just make out that they have been. We had a choreographer, we had fashion designers, makeup artists, all of them who contributed hugely to making. We had mother and daughter combos, as you can see here, and all this went a long way. What we try to do through the TV and the media is create awareness amongst these people that breast cancer is definitely curable, and women live with a lot of style through this entire event. Thank you. That will be the end of my presentation. Thank you, Taruna. Thank you, Sajni. I would also want to thank Bhagya Lakshmi, who was responsible for coordinating the event.
Thank you so much. I will definitely convey the message. I'm sure she's on, but I'll convey the message. And if there's room for question, one question that was sticking out, which we normally don't hear about is, if I may ask, people with dense breast tissues, okay, do they have a higher chance of developing breast cancer? What I mean is a heavy breast. Does that have a higher chance of, having breast cancer?
Size of the breast is not important as far as the chances of getting breast cancer are concerned. There is something called breast density, which you can appreciate on a mammography. So if the breast is small but very dense, then breast density is considered to be a risk factor for developing breast cancer. Large breasts it is not like a disease. Some women could have large breasts. Only for cosmetic reasons, you might need a reduction mammoplasty, but I do not look upon it as a risk factor.
So the density is what you have to be worried about. Yes. Okay, so that was one of my questions. And I don't know, what are the recurrences of a breast cancer after you had it once? What are the chances of recurrence?
Recurrence depends upon the stage at which you are diagnosed. Suppose they are diagnosed in stage 1 and stage 2. As I told you, in stage 1, nowadays there is chances of cure are excellent in excess of 90%. Unfortunately, a majority of women in our country come late. So that is a big challenge. So as I told you, in US, they have telephonic reminders for mammograms. So the institute calls you that you are now due for your mammogram. So that is the way they follow up patients. Unfortunately, we do not have that mammography system in place. Therefore, women come to us only when they feel a lump. By the time they feel a lump, then it has to be of a certain size. And there are millions of cells within that tumor. And therefore, the chances of it spreading to other parts of the body, even after treatment by surgery, chemotherapy, radiation, are there.
So can we do more programs on awareness of having the mammogram done? Because that we don't hear about, just the way you said in America or other Western countries, they give you a reminder. The doctor's office sends you a reminder. But here we don't have any such things. But is there any other way? If no reminders from the doctors, at least we can have more awareness through programs, just the way you have the awareness of breast cancer. But yeah, that's awareness of not to get it, what you do if you happen to get it. How about creating an awareness that before you get it, go do this. You're 40, go and get a mammogram. You're 35, go get a mammogram if you have such symptoms. So awareness, I think, and maybe we can start with the masses in the rural areas and also the urban areas. But I think that awareness from this program, I feel is more necessary when you have the ratio of 1 in every 25 women being diagnosed for breast cancer. I think, if I'm not wrong, that's the ratio you gave, right? 1 in 25? And there's
1 in 25, yes.
Yeah, there was something about 1 in 5 also. Was it daily or something like that?
No, one.
Okay.
One case every 5 minutes and about 300 cases every day.
Okay.
So everyone attending this seminar, webinar, whatever, can go and just make sure that they have got their own mammograms done and also of their family members. And that is, everyone encouraging the next person to undergo the subsequent mammograms. Mammograms are now freely available in Anand and at Karamsad and even in smaller centers. So everyone should have access to mammography machines, and beyond the age of 40, go ahead and get their mammograms done. So that is a very important message of today's meeting.
Thank you so much. And I must thank Sajini for, really be after me to make sure that we had this program, because, she believed in you. She believes in the awareness of breast cancer, as we all do, actually. We all believe in it. We just don't do anything about it. Although it was on the plans for us, but COVID has really set us back in many ways, and this was one of them, but we managed to have it, and I thank you all for being with us today. Sajni, I will let Dr. Rachna give the vote of thanks if Dr. Vijay is finished with anything that you may have to say.
I'm done. Thank you very much, Taruna. Okay. Thank you, Sajni, for saying such nice, kind words.
Just one thing I wanted to say, that there are some questions which have come on the chat. Maybe if Chitra can compile them and send them to the doctor later for answers for your team, because a lot of people have a lot of queries. And since there's no time to look into it right now, maybe it can be handled later. Thank you. That's all. That's all.
Yeah, definitely, Sajni, we should do that. And I thank all the members and friends who are on the program today, and we'll definitely answer the questions. And the other thing is, there is a little gift for you from us, FLO Ahmedabad chapter. Chitra, if you can just post it, please, for all the panelists and the doctor. So we have a gift for you, a day's stay at Madhuban Resort and Spa, and I wish all of you come together as a team, and we'll have a party here, and we'll invite the FLO members also as soon as possible. So this is a little gift for us, for you all from us. Thank you again.
Thank you. Thank you so much. It's a wonderful gesture from you.
And Rachna, please go ahead and give the vote of thanks. Thank you.
Good evening, friends. I, on behalf of FLO Ahmedabad chapter and the entire team, and even our guests in the audience here together, extend a very hearty vote of thanks to Dr. Vijay for being with us here today. He has busted many myths and misconceptions about breast cancer. Often we women take a back seat when it comes to our well-being, but after this webinar, I'm sure we will be more mindful of our own bodies. And I think we can make a promise of getting a mammogram done annually or biannually as is required. I think even FLO Ahmedabad as a chapter can have an event where we all members go for a mammography together, if possible. Your suggestions were extremely valuable, and I thank you once again, Doctor, and your entire team of panelists. Finally, I would like to thank our sponsors, Madhuban Resort and Spa, Phoenix Creation Simplified, Satyanarayan Jalia and Sons, Sanket India Anand, IT partner EITL, design and print partners, iCash Printing and Stationery, our PR team, TVM Communications, for their enormous cooperation for this event. Once again, I thank you, all of you, and stay safe and stay healthy. Thank you so much.
Make sure that you come with, wear your masks, maintain social distancing and hand sanitization. And we'll be more than happy to have Rachna Gemawat with us at HC Cancer Center.
Yes, definitely. My mammography is due. As you know, I'm your patient, and I'm supposed to get it done in December now. So I'll be there.
Thank you so much. And I liked one thing that Rachna said, that we can all go together, probably as a FLO team. We'll have a date set out for mammogram for all the women. That's a new thing to begin for FLO. And what a wonderful thought. So Dr. Vijay,
mammogram kitty party. So
yes,
6 women, 8 women come in 2 cars, get the mammograms. We'll have some good tea and snacks, and then we'll let you go.
Thank you so much. Yeah, thank you. A lot of takeaways, Dr. Vijay. Thank you.
Thank you so much.
Yeah, thank you, everyone.
Thank you, everyone.
Okay, bye. Okay.